All right. Hello, everyone. I'm sorry we're arriving a little late. I honestly was in clinic and I just ran down the street to be here. So, we're keeping it real as we go in this course. There are lots of patients who needed my attention. So I thank you for your patience. I'm very excited to be able to introduce and honored to be able to introduce Dr. June McKoy today. Thank you so much for being with us today,
You're welcome.
June. Yes, you call me Melissa, please.
Melissa.
So June is an amazingly accomplished physician, and she has a law degree. So you also can practice law, correct?
Yes, I'm licensed.
And she has a MBA as well, Master's in
Kellogg.
From Kellogg here at Northwestern, a Master's in Business Administration. So she is a very accomplished woman. She also leads the oncology program that's focused on seniors, geriatric population. So an extremely important effort here at Northwestern. So thank you again for everything.
You're welcome. I'm happy to be here.
So we are going to talk about this week's work, that you've been working on, which is about leveraging your personal story. So really trying to tie who you are, where you came from, why you do what you do. And so as much as possible, we're going to try to talk about our personal stories and answer your questions and tie it all together, because we know that personal stories really can help make an impact on your future career and your ability to actually secure your jobs. One plug that I want to do before we even go into this is this career portfolio. This is really important. This is an amazing resource. It's like a worksheet that guides you through all of the things that you need to have ready so that you can go apply for a job, apply for an internship or volunteer position, or even get ready to apply for higher education of any form. This will really walk you through, and all the exercises that we've designed in this 6 weeks course actually help walk you through each part of this career portfolio. So, June, can you share your personal story and how you got into your current career? What your career trajectory and what led you here?
Well, listen, my journey has been a long one, and it has been serendipitous. So a lot of opportunities came my way, and by chance, and I snatched them up. When I started on this journey, interestingly enough, I wanted to be a psychiatrist. Well, a psychologist. I started as a psychologist. Okay. So when I came to college, I came to be a psychologist. And when I got to college, one of my professors suggested that maybe if you want to be comprehensive and be able to write prescriptions, you might want to go into psychiatry instead. So I thought about psychiatry during undergrad, and when I got to medical school, and then everything changed. But even before I thought of being a psychologist, a lot of careers came to mind. I thought of teaching, and in fact, in our high school, we had the opportunity to get a teaching certificate. Mm-hmm. So teaching was an option open to me. And yet, look at where I am now. So I've had this great long transition to this current point. So if you're talking about students out there who really are thinking, or people who have had one career thinking of changing to another in the healthcare field, the opportunities are there. So basically was able to get into medical school. Along the way, a lot of people mentored me and gave me that opportunity. So I made it into medical school and completed it, and planned to go into surgery, did surgery, and then transitioned to medicine. And now I'm taking care of older patients who I adore. Mm-hmm. And in the space, in a general sense, and also I'm taking care of patients, older patients who have cancer problems. That I'm not actually doing oncology because I'm not an oncologist, but I've been able to leverage my expertise in aging to actually support, hopefully, improved outcomes for older patients. So my journey has been a long one, but the twists and turns that I've had to take to get there were all worth it. And I think that's where I'm here, why I'm here today, to kind of tell your audience or the people who have tuned in that they can make it. It wasn't a smooth journey, by the way. I wasn't a typical traditional student. I did other things and then transitioned into medicine. And I can certainly talk about a little bit more about some of the other things I did if Melissa wants.
Yes, I do. I think that would be very fascinating because many of our the participants in this course are actually considering a career change towards either they're already in a health-related career or a research-related career and would like to jump to another either research or health-related career.
Well, for those considering a change in career in particular, I taught for a little bit between what we call in the British system kind of high school, which was total high school included 2 years of what you call junior college year. Mm-hmm. So I came out of high school with a teaching certificate, literally, and taught for about a year and a half. I don't think we've ever talked about that. So I was actually a teacher of science for a while. And then, I enjoyed it because I love young people also. But I knew I wanted to do something further. I wanted to actually not only teach, but apply the science that I had learned to actually taking care of people hands-on. And during that period, I contemplated being a nurse, but actually did not go into nursing. I have a sister who went into nursing, and her journey is an amazing one. But so I went from teaching, going back to finish up my degree, and then transitioning to this country, come to the United States, taking 2 more years.
Where were you? I'm sorry.
I came to Chicago.
Where were you outside of the United States?
Oh, outside the United States, I was in Jamaica earlier on, and then living in Manchester, England. So I've been to a lot of places. Mm-hmm. So my journey has not only been a journey of changing careers or transitioning through different segments of the so-called healthcare arena, but I've also lived in different places to get to where I am. So I think I can really speak to the fact that you can make your changes at any time in your life, at any age in your life. You can transition from one career to another. And healthcare is so broad that you can fit into several different niches that if you want. You don't have to really commit completely to one. You can move from one to the other. And I'll tell you why I can talk about that, because at first I did general surgery. So I came into healthcare, went into a specialty, and changed specialties. So you can not only change your career from something totally foreign to medicine or to healthcare, but you can change within healthcare from one area to another. And that's one of the reasons why I think those who are out there who are listening to us should really look at healthcare closely. It's a very, very, what I call diverse segment of the careers profession, or the careers, a very, very diverse career segment. Has lots of opportunities for people coming entry level. You can come in as a phlebotomist. You can stay as a phlebotomist. There are people who enjoy a long career in phlebotomy. You can come in as a phlebotomist and move to being a medical assistant. A lot of people come in as certified nursing assistants, go to school at night, move on to becoming nurses, either through 2-year certifications or going on to do their bachelor's degree. So it's just that kind of, what we call profession or career, where you have multiple opportunities to really move across the sphere of the entire healthcare arena. So again, from teaching, I went in to medicine, and here I am.
Excellent. Can I just ask, why law? Why JD?
Well, which came first? People ask me, the chicken or the egg? And a lot of people actually, without knowing, will say to me that they would think I was a lawyer before I became a doctor. And actually, we're seeing a lot of that. We're seeing a lot of lawyers finding out that law is not their passion anymore, and that healthcare provides more satisfaction. So they're coming in, and they provide diversity to the healthcare arena because they're coming in with additional skills that really can benefit patients. So we see a lot of that happening actually on the medical school committee on which I sit. A lot of lawyers coming in. I went into law by chance. So we talked earlier about serendipity. I went into law by chance. I was working at an HMO, And I'm not trying to beat up on HMOs now. HMOs have been good to this country because they've really forced us to actually try to manage or the dollars spent, and we need to be aware of that. It doesn't mean that they're bad. We need to be aware of that because we will eventually run out of money if we're not careful of how we spend our dollars as the population ages and more people are ill come into the healthcare, into the hospital or the clinics for care. So I was not pleased with the fact, though, that there was an overemphasis on saving the money. It's okay to save the money. It's like, you've got your child and you're saying, I've got a budget, and your child says, I want a Michael Jordan sneaker. I hope the audience knows who Michael Jordan is, a great basketball player from Chicago. And so they might say, I want a Michael Jordan sneaker. But you might say, well, let me buy you the money. We've got a budget. I'll take some money out of the budget for something else, although it wasn't planned. But I don't think it's a good idea to take the money out for a Jordan sneaker. What we found in managed care was that but your family might be willing to give you a little money for something else. Maybe not the sneaker. Maybe the sneaker if you've done really well in school or something. But at least they give you something. But they keep some. They give you some and keep some. What I saw when I was working in managed care was that there was a more emphasis on profits. I think we're seeing a little shift over the decades now, but I saw a lot of emphasis on profits and at the expense primarily of older individuals. And at the end of the day, many doctors bought into that because they could. Any money left over in a particular managed care entity would be shared up among physicians. And it pains me to talk that way, but I think transparency is very important. And I'm trying to be transparent here. So I went to law school to actually fight against managed care. And then after the first year of law school, I found out I couldn't do it. I couldn't fight managed care because the Supreme Court came out with a ruling called the ERISA ruling, E-R-I-S-A, and you can look it up. Since many of you want to come into healthcare, you need to look that up because it's going to impact how you practice medicine going forward, or nursing, or any of the healthcare professions. So in a nutshell, they found that it would be against public policy to allow individuals to sue managed care entities. That's the basic premise of ERISA. And I thought, well, being a person who doesn't really give up on things, and I saw that there were great skills I could gain from law, I just continued on and finished it up. So I finished my law degree and I took my bar and I passed the bar. Go Illinois bar very hard, passed the bar, and actually practiced of counsel with a couple of firms, while at the same time coming back to Northwestern to do a fellowship in geriatric medicine. So I was doing kind of straddling two professions at the same time. And ultimately, of course, not only did I love older people and felt that geriatric really fit the mold, but my mother threatened me. She said, you don't go to medical school, get a degree, go off to law school and never practice medicine again. My mother said, you need to really, really go back. So with my mother on my back, I came back also. So for myself and with my mother's stick over my head. And I have not regretted it. Yeah. Healthcare careers are amazing. Right. You become part of a team. Mm-hmm. And as I said before, we're seeing people even coming back to medical school, coming to nursing school after they've finished one career. Mm-hmm. So there's no age limit. They cannot discriminate against you on age. You can figure something out with your family. It means if you're a person trying to come back, I think, have a talk with your family. I have to tell you this story. There's a young woman, actually, I won't say where she is, but a young woman I met recently who works for an academic institution, who wanted to come to, and we're going to talk about medical school now, but this can apply to nursing school too, wanted to come to medical school. But took the MCAT and initially didn't do well. Mm-hmm. And what she did was she put that on the back burner after, I think, 2 tries of the MCAT. She had taken some post-bac courses, and I actually did well in the post-bac courses. And these are courses people take after they've finished their undergraduate degree or bachelor's degree. They go and take these special courses to qualify to fulfill the prerequisites for medical school. So she took these courses, and then she, of course, got married, has 2 children now, 2 boys, I believe. And I happened to meet her at a workshop retreat. And we got to talking at the end, and then she said, you know, yeah, I've always wanted to go to medical school to become a doctor, but that's not for me anymore. And I asked her, why not? Well, she said, I'm married and I've got 2 children. And I told her, is this your passion? I asked her, is this your passion? She said, it's my passion. I really want to do it, but I cannot, you know. I said, okay, all I wanted to know, I said, no more. Again, is this your passion? Yes or no, that's all I want. And lawyers, that's a lawyer part of me. You only want yes or no, nothing else. And she said yes. So I said to her, I promise you this. I want you to go home, talk with your husband. I said, this is your passion, and years from now, you're going to regret that you never did it. It doesn't mean you might not be able to come back and do it, but having 2 children, you're going to get deeper into not thinking about doing that. And I think it's going to color your future. I said, think what you can do for your children by entering the healthcare professions. A lot of opportunities for the children. I asked her to go talk with her husband, and I told her, this is my promise to you. I will pay for you to take a Kaplan course to prepare for the MCATs. I will pay for the exam that you take, and I'll pay for all the double AMC questions that you download online. And that's the American Association of Medical Colleges. They've got questions that people can use to prepare for the MCATs, and they're pretty good prep questions. And I didn't hear from her. When I came home that night, I wrote an email kind of recapping what we had talked about, but didn't hear from her for about 2 or 3 days. And then I got the email. That she said, Dr. McKoy, I'm ready.
Awesome.
And I think that's a story that I feel good about sharing with you, because there's so many of you out there who really want to take that leap. And if it's something passionate to you, even if it's not a deep passion, but you have this thing kind of boiling in you, this in your belly that says, I should go into healthcare, I should do this, take the chance and step in. You won't regret it. It's just amazing opportunities at all levels of healthcare.
Awesome. Thank you so much for sharing. That was
welcome.
wonderful. So there are a ton of questions piling up as we're talking right now. So we're going to start answering questions. The first question is, what are some important things to do in high school that will help one's chances of getting into college for pre-med? What things would make one stand out from other applicants?
What you want to do in high school is to, let me get away from the academics for a minute. You need to get involved in activities on campus. For instance, if there's a science club, get involved in that. If there's an opportunity to be a leader at your school, get involved. Be a member of the student council. If there's an opportunity to do volunteer work, like a lot of high school students do things like cleaning up parks and so on. So get involved in activities that actually broaden your network. You meet a lot of different people, get a lot of experience from that, and those will actually inform or improve your application for college. So there's a greater chance of you not only getting into a better college, but also maybe getting a scholarship to college. A lot of colleges giving scholarships look to see what your extracurricular activities have been like. And they're looking for, they're really starting early now. They're looking for leadership, and a way to get leadership is to join a club. I know that you're busy with studying, but it shows us that you're well-rounded, and it makes you an applicant who stands out. Now, and that would definitely be one of the reasons why you would stand out for a college over other applicants. If you're a leader, if you've done other things, if you've been in a science club, if you've written something, just being involved in school improves your chances, because number one, you'll get stronger letters of recommendations from your teachers.
And if you're a player on a team, a sports team, or if you're really passionate about playing piano or another instrument or dance or something, if you're a writer, just take it to that next step. Follow the passion, do well, involve yourself in something that's related to it. And if there's a depth and a breadth of that experience, that particular thing that you're passionate about, that's going to shine through in your college application. And it will help you if you continue through with that in college as well to some extent, because then you can tell that whole story and the trajectory by the time you get to your medical school application. And that's really important as well. The next question.
I'm currently a paramedic. And, oh, I'm sorry, next question is, what is the job process like for getting hired at a hospital, either as a doctor, a nurse, or surgeon? Well, it really depends on the profession. And so for a physician, you obviously have to have all your credentials lined up. Same with a nurse. You have to have, or a physician assistant, or anything for that matter. You have to have your degrees available. You have to have taken your tests if there's, depending on where you live in the world. For example, in the United States, you have to have a licensing exam for a physician and for nursing at certain levels of nursing. And you have to have passed those tests, as well as be able to provide your transcripts, your degree, your diploma, copies of your diploma. So all of that stuff requires multiple steps and multiple documentation in order to get a position as a physician or a nurse or any other clinically related position at a hospital. Do you have anything to add on to that?
I think Melissa's been pretty comprehensive with that. Also, remember, for people especially who are not, literally for everybody, having good letters of recommendation to wherever you are. If you're planning to cut your ties with that particular job, try to leave on the upside of the job, and so that you won't have someone who is not unable to give a strong testimonial if asked. Because even for doctors and nurses, what happens is that letters are sent out to ask if there were any problems, any concerns that a previous job might have had with that particular person. So credentialing is strong when you have a strong background, and so keeping on the upside of any job that you're planning to leave is a good idea.
And remember, the circles are small as you get up in as you move up in your profession. So always leave on a good note, as much as you possibly can, because you never know who's going to know who in that social network that you're going to learn about next week. The next question. How does a busy physician or surgeon keep up with the continuous innovations that often, if not frequently, change routine ways of practicing? Would you like me to tackle it? Why don't you try that?
As Melissa will add on, you have to really take continuing education courses. Even, and I know this is not medicine, but even lawyers do that, and they will take courses with relevance to medicine too, because many are malpractice attorneys. But you take these continuing medical courses. The American Board of Internal Medicine, the board in which I am certified, or the American Board of Medical Specialties, require that physicians actually just about every 10 years retake what we call their boards. So they recertify. And that's in an effort to make sure that we're keeping up on top of our requirements. In addition, individual states have requirements for their physicians. And this is on an honor system basis, where the physicians, when it's time for them to relicense, will have to state that they have taken at least, I think, 50 hours, certainly for Illinois, of continuing medical education courses. So that's one way of doing it.
For obstetricians and gynecologists, we actually have to recertify every year for boards, and I do have to have 50 hours of continuing education credit every 2 years as a requirement of the state of Illinois. Now, around the world, that's different. You need to know specific requirements for where you are, where you live. But in terms of keeping up on top of things, that's actually one of the reasons why I love being the educator, because the residents and students and fellows are constantly keeping me on my toes. They're asking me questions. It's like my children, right? They're always asking me questions, and I have to figure out the right answer because they need to know the right information. My patients keep me on my toes. There are many times when they'll ask a question and I'll won't know the answer at all, or I'll know a partial answer, or not be able to explain it in a way that makes the most sense for them. And I kindly and politely say, I need to go look it up and I'll come back. And so there are a lot of resources that are available online or in the library that will help me keep on top of my
knowledge. I also look at journals within my specialty, and those can be online or in paper copies at the library as well. And so there's constantly all kinds of information that we are trying to get through as much as possible.
Melissa has been very comprehensive with that. Just want to add on that we all belong, as educators in particular, we belong to medical societies, and the annual meetings that our societies have provide us with opportunities to really keep abreast of changes in the particular specialty.
Absolutely.
And that would be across the world, I would think.
Yes, absolutely. Next question.
Melissa mentioned coming from a non-traditional medical background with people saying you would never make it. How did you stay the course, finding mentors, etc.? Were you always very resilient, or did you have to acquire inner strength?
I would say absolutely. I was very passionate about helping people. I knew that I wanted to make sure that people did not have to go through what my family and myself had to go through, and other people that I was watching around me go through. And so that was my commitment to my career, that I was going to follow my passion to make the world a better place in terms of health and equity for everyone. And that is my steadfast passion. I have not veered from that in any way, shape, or form. Now, that doesn't mean it's been easy, but what I did do along the way are a lot of the things that we present in this course. Really trying to be better at articulating my story, being true to self-reflection, and making sure that I'm running the right course, as Dr. Nicholas Pierce talks about in his lectures, and that I stay on the right track. Now, there were a lot of people telling me there was no way that I was going to be a doctor, or that my research wouldn't have legs. I mean, those were told to me verbatim. And if you have a passion and a goal, you're going to follow it. Just like Dr. McKoy said about asking the young woman, was her passion to go into medicine? And she said yes. And sometimes you just have to take that leap of faith, and it takes a lot of courage, and it takes a lot of support as well. So I had a lot of support along the way. You have to have your eyes wide open to be able to see who's willing to offer you that support.
Next question. Would you recommend going to your dream school for undergrad, or would you recommend going to it just for medical school? I know that you might not have a good chance of getting back in if the school is exclusive and wants only a small % of alumni.
I would say if you can get into your dream school and you can financially afford it, or they give you, better yet, they give you scholarship and tuition assistance, go for it. Actually, a lot of the schools in the United States that are Ivy League or higher tier actually do like their alumni. And quite frankly, most universities do like their alumni, and they do tend to keep them or prefer them in the admissions committee sometimes for that next step within their own school. But that's not always an advantage. Sometimes, like for instance, undergraduate school here at Northwestern, when we both sit on the medical school admissions committee, when we're looking at people who graduated from the undergraduate here at Northwestern University, we know that the level of curriculum, we know the bar that's been set, and then we can actually understand the context in which the grades are received on the transcript. So we have more intimate knowledge, but that doesn't necessarily mean just because you came from Northwestern undergraduate, you would get into medical school at Northwestern. But if you have all A's and are a stellar student, you definitely have a chance of getting into medical school here at Northwestern from undergrad. I don't know if you want to give more detail, June.
I think Melissa really articulates that quite correctly and well. In addition, in fact, let me tell you something. Actually, the stars are aligning to make things happen that I can talk about today. Because I got an email, I think it was yesterday or the day before, that I responded to early this morning. And the student's going to be shocked that he got it so early, like 5 o'clock in the morning. But I responded because the student was accepted to our medical school. And the student has gotten into his state school. And this is his dream school, but he will likely not come here. We're a great institution, but our tuition is higher. So sometimes you get into your dream undergrad school, your dream medical school, but you cannot, the tuition is really too much for you, and you're not getting enough grants and so on. And I would say go to a school that will give you the framework that you need going forward. Hopefully it's your dream school. But if you can't go to the dream school for many reasons, like even the financial part of it, it will not stop you from getting into the medical school that you want to go to eventually, because it's going to be really based upon your activities, your leadership, and your academics. And they will trump anyone from our undergraduate schools profile if yours is better. We will take you over them. So I think that you do have a lot of wiggle room if you can't get into your dream school to go to another school and do the best that you can.
The other thing I want to mention is just because you didn't get into your dream school doesn't mean you can't get a job at that school later on. I did not get into Northwestern. I did not get into Northwestern for medical school or undergraduate or for residency training. And I'll be honest. But here I am in a leadership position and thriving at Northwestern. So it all comes full circle at one point.
And that's what I actually put an example to the student of an intern of mine who actually came from medical school in South America. Was my intern when I was a second year doing my medicine residency. And he now is one of the youngest chief of critical care and pulmonary medicine at a top institution in the Midwest. I won't say the name. So, and he made that leap, and he never even went to an institution here. So even if you're in another country, you do the best you can. Mm-hmm. You'll rise like cream to the top.
Right.
And you can come back and it can be your alumnus because of a postgraduate training.
Right.
So you can be an alumnus of a program without going to the undergrad school.
Right.
There you have it.
Right. Next question. What suggestions do you have for preventing burnout? Do you want to go first?
I think you should go first. I think you've got a good handle on that.
You got to follow your passion. If you're not doing what you love to do, you will burn out immediately. It's the love and the passion and the fire in your belly is what will keep you up at night finishing a particular project that you want to get done. It will keep you getting up in the morning and having a smile on your face no matter what you face at work or if it's school. If this is what you want to do, you will do it. And that, for me, is really important for preventing burnout. The other thing is do not forget about yourself. This is a health course, right? This is a course about health careers. And unfortunately, actually, physicians are some of the worst people who take care of their health. Like they do a horrible job of going to the doctors themselves. We don't do a good job of taking care of our own health. We're so focused on helping everybody else's health. And that applies to clinicians across disciplines. So you've got to take time for yourself. And that is not just to go exercise, but to eat right, to have a mental health break, like to be spiritually and physically and mentally well, to take time if you have children or family, or do something that you love to do, because it is really important to distance yourself from work on a regular basis, to make yourself more of a well-rounded person. It actually makes you more interesting at work when you have other fun things that you do. For instance, if you love to cook, don't give up cooking just because you have a job that is sucking you in and making you work 24 hours a day, 7 days a week. There are ways to keep what I would call sane and healthy and well and thrive. It's really important to maintain that balance.
I like the fact that Melissa mentions balance. It's very critical, and it's very hard sometimes to achieve. Exercise, which I must admit I don't do a lot of. I like to sometimes say, well, I do walk a lot. I walk miles to my office. But I don't know if Melissa minds my saying that. That's why I defer to her first. Melissa exercises. She takes time to do that. And I'm trying to be better at that. I'm trying to eat better. What I do, though, I do quite well is I really surround myself with people who are supportive and who are not necessarily only in the profession in which I am, so I can get a broad perspective on what's going on, and that's really kept me sane. Recently, I had to pencil in my mammogram, pencil in my pap smear. I got so busy, I forgot that I had not had a pap smear in 3 years. And so I ran and got my pap smear done. I know I'm being a little personal, but I think it's important because there are women out there all over the world, and they're missing their pap smears too. But life can actually get such that you forget about yourself. And it goes back to what Melissa says, in order to be good for everybody else, you've got to be good to yourself. I think that's a takeaway message.
Absolutely. Next question. I'm currently a paramedic and computer programmer in Poland. I aspire to be a physician in the US. It's very hard to start getting information from another country. Could you discuss that topic on that Hangout? So how do you become a physician in the United States? Well, we
have a lot of applicants who started out in another country and got here eventually. One thing to do is, I would say, apply to either an undergraduate or graduate program in this country. Unless you plan to do your residency in your country, go to medical school there and actually not do your residency necessarily, but finish medical school there and then come here for residency, the pathway is going to be different. So if you decide to stay in Poland and go to medical school there, and I don't know the requirements there, I want to believe it's similar to the British system of 6 years of high school, 6 years of university. But if you complete medical school in the 6 years in your university there, then you can come to the United States to become a physician actually by applying to a residency program after you've taken your step 1 and your step 2. So that's a way to come here. And you can look up online the USLME examinations. You can also go to the ECFMG website to see what they have. Because they're the authority on the credentialings and the credentials you'll need to come to get into a program here. If you opt to not do medical school and to come here and do graduate studies, then you need to apply to the specific graduate program. And there should be a book on graduate programs. Again, you can go to Google and look up graduate programs in the United States, and it will give you a branch off to different institutions. It might be an easier route in a way to come and do graduate work and then take your MCATs. Sometimes it's not totally, the MCATs are the medical college admission tests, and everybody takes them to enter medical school. There are medical schools in this country that don't need you to complete the total undergraduate program. For instance, Northwestern actually does not require that you have a degree at the time you apply to the medical school, but they require that you have a degree by the time you matriculate, by the time you enter the medical school. So in a nutshell, if you do your medical school abroad, you can take the USLME examination, the US Medical License Exam. Go to the ECFMG website to check on that. If you come here and do your graduate studies, I would advise that you finish the program or your undergraduate. Finish your degree first and then apply to a medical school. The stumbling block to getting into a medical school that way is that many schools sometimes, if they're a state-run school, they might not take you if you only have like a student visa. But there are private schools that will often take the students in. And we have many students in our medical school who came on a student visa and they got into medical school. The only thing is that you have to try to find grants because you cannot get scholarships. And you have to get grants or loans, but you can't really get scholarships if you're a foreigner coming to a US medical school on a student visa. I hope that's kind of clear.
Yeah, no, that's very clear. Thank you. So the next question is, you said something about
majoring, I'm sorry, I can't read. You said something about majoring in a different area during undergrad. Will it help my chances of getting into a good medical school, or will it hurt it? Does it even matter to them? Well, I'll tell you, we get stacks of applicants for medical school. I mean, piles that are way taller than both of us standing on each other's shoulders, and thousands for each spot. And if you can imagine, people applying, for example, to Northwestern University Medical School are really high caliber. They have great grades, they have great MCAT scores, which is the admissions test for medical school. They have volunteer experience, they have research experience, they have a lot of things. So what's going to make them different? And that's the key, because as we're reading these hundreds and thousands of applications, something's got to stand out to us. So we look at what strengths the applicant brings. Where is the applicant from? Do they speak lots of different languages? Have they volunteered for a significant period of time in a particular area? Have they done a particular activity for a long time and it's blossomed into something beautiful and they're using it to help other people? What did they major in? Is it photography? Is it art? Is it psychology? Is it science? Whatever they major in, it's got to match the passion, and there's got to be a reason for it. You don't just say, I majored in art because I wanted to be different so I could stand out in my medical student application. That's not it. But if you really like photography and you really like art or theater, or you're passionate about classical music or Greek literature or Latin American studies, etc., then do it, and then tell me why you did it. And connect it to something else that you've done for other people. So have that circle and be able to tell that story, because if you can tell the story in a great way and you've achieved and done well in those grades, because grades do matter, then that is where it's at. So if, for instance, your passion, whoever asked this question, your passion is biology, then major in biology, and then connect it to research that you volunteered for, that you've worked in a particular lab, or connected to helping students in high schools or junior high schools with science. Connect it to something. Make the story compelling that will grab me when I've read my 100th application and it's midnight and I have 100 more to look at before tomorrow morning, right? That's what I was mentioning. And you don't have to just say, okay, I'm a pre-med, so I have to do all my pre-med classes and I have to major in biology or chemistry or organic chemistry or physics. No, I mean, you can do engineering and take the pre-med requirements. You can do fine arts and take the pre-med requirements. But I want to see the story, and I want to see that you've done well in whatever you've chosen to do.
I think that's a good point, Melissa, because students shouldn't take a science major because they believe that they have to do that to go to medical school. You don't have to be pre-med to come to medical school. In fact, we have people who have done economics, art, music, as Melissa says. And, I sit on the executive committee, and I've been on that committee since I was a fellow for a long, long time. And consistently, we are excited when we see this application that has some, anthropology or something. But as Melissa states, you do it only if you have the passion for it, and you need to at some point kind of bring it around, because you're going to be asked to write a personal statement, and we hope that you can actually show how your art really applies to medicine and how it has made you a different person, maybe more empathic, more considerate, or someone with more dimension. So if you can bring it around and show how it applies, that works well. Just so you understand, we really like students who are different. And on that note, if I just throw on, we like people who are not what we call traditional students. So if you have left undergrad and gone and gotten married, if you've worked as a photographer and come back, if you've joined the Peace Corps, that's all good. Understand that students applying to medical school now literally are building bridges. I'm talking real bridges overnight. They're erecting houses overnight. So you have to have an application that just grabs the reader when you have 100 and it's night and you're tired. If you can't enjoy that application, you tend to maybe rate it a little bit lower.
And that's where telling your personal story is really important, and being able to connect the picture, really connect the dots. And that's where
starting with doing your career portfolio is actually really important, because this helps you outline on paper visibly to start you on the path of connecting that dots and making it whole, so you can convince people like June and I that what you're doing really does follow where you want to be and who you want to be and how you want to contribute to this planet. The next question is, how much difficult is it for a recent graduate of a medical school to start residency in the United States while in his early 40s? Have you heard of such cases? Absolutely. Absolutely. It happens all the time. And people change careers. I know people who went through the whole pipeline, has started, like Dr. McKoy here, started in one career, surgery, and decided that it just didn't match with where they wanted to be, and repeated residency in another discipline, in medicine, or neurology is one. Some people transition from medicine to neurology. I know people who have left OBGYN to go to family medicine, or general internal medicine. So it happens all the time. It really is about what you want to be, what's your passion, and is it aligning with what you're doing. It also obviously does depend on what your support is, right? Because you have to have a supportive family, or whatever your situation is, to be able to allow you to go back and be a resident again, because it's not easy to be a resident and to go through training for a wide variety of reasons. So.
And speaking directly, I have a feeling that this might be a specific case. Speaking directly to this person who has a recent graduate from a medical school in the 40s, we see that sometimes it might be harder to go straight into a specialty residency. But for family medicine, internal medicine, you can do that. My advice, if you really have a special case or someone out there is falling into this particular scenario, is that you apply to smaller residency programs. They're usually affiliated with hospitals. So New York City has a lot of great programs. Lenox Hill is one that comes to mind in Illinois. Programs, St. Francis programs at Mercy Hospital on the downtown Chicago, near South Side, but smaller programs will be apt to take those residents. And I've seen residents in the 40s go into those programs, and they have done well, and then they have gone on to doing fellowships at places like ours, Northwestern, the big academic centers. So what you want to do is put your foot in the door and don't give up because of your age. Number one, we cannot practice ageism here and use that to hold you up, but understanding kind of starting a little bit late and the competition being strong, I would go for smaller programs. St. Francis is another smaller program in Evanston, Illinois, that really is quite good.
Right. Also, I see a lot of examples from people who've graduated and are actually professionals in another country and want to come into the United States and repeat residency. And what happens is, for example, my father-in-law was an ophthalmologist, an eye doctor in China, and he eventually came to the United States and redid his residency in psychiatry. And so it really, it's about fit, it's about what you're positioned to do, and it's about being persistent, because sometimes you do have to apply a year or a couple of times before you get a spot. So don't give up, though. That's really important. The next question is, I'm interested in earning credential in healthcare administration. In the interim, what is the best way to gain employment in a healthcare setting?
I would just say apply to any hospital and take a position that gives you exposure to the inner workings of a hospital, and you can find out something about the inner workings at literally every entry level job. If you're in the United States, and particularly in Illinois, I know that Northwestern has it's an internship program for people in healthcare administration. It's not a large one, and I'm not sure it's super competitive, but it's not a well-known thing. but they do offer internships, and other hospitals do that. But that being said, I think you're asking about how do you get experience just working within the setting. And I would say apply for any available position. And once you get your foot in the door, you can always transition laterally to another position and so on and so forth. And keep your eyes open. Maybe seek out a mentor when you get there. Just talk with someone, maybe a nurse on the floor, maybe someone, in an office, and they will help you to move up the ladder and to learn a lot more.
So again, yes, absolutely. Couldn't agree more. Get your foot in the door. Now again, this depends on what your resources are, because some of you may need a higher salary than others. And when you're trying to transition into a new career or a new path, sometimes you do have to go down a notch in terms of the level of job and be more at an entry level job. But once you get your foot in the door, and how you find jobs is you can go on the internet and actually search human resources and at a wide variety of hospitals. And I would search widely from different levels of institutions, private community, local community hospitals, private hospitals, big academic institutions. There's always a human resources job listing, and just keep applying. But you have to have a good cover letter, a professional email, a good resume. You have to understand, you have to have good interview skills, all of those things that we have in this course that will help you. So you need to practice. So review the videos, practice your exercises, make sure your career portfolio is well put together, because that will help you get in. And then when you get in, just like Dr. McKoy said, use your social networking skills that you've built through this course as well, because you start to get informational interviews of your colleagues. Talk about their job position. What do they like about it? What don't they like? What skills did they need? What really helped them? And where are they themselves thinking of going next? And always keep your eyes out. I know even my team members are looking at the job boards to see what kind of other possibilities there are. It happens all the time.
And then if I might add, in terms of healthcare setting, remember, it doesn't necessarily have to be in a hospital per se, because I think this person asked about healthcare setting. You can, in a skilled nursing facility, that's where people go for rehab after they've, say, had a fracture and they've left the hospital. It can be even in a nursing home, because nursing homes are very intimately connected with hospitals these days, especially under the United States Affordable Care Act.
And community clinics.
And community clinics.
Thank you for reminding me. Think broadly.
Think broadly.
The next question is, to complete my previous question, what's the best way to acquire experience in healthcare administration while earning a health administration credential? I'm eager to earn while I learn. I think we did. I think acquiring healthcare experience really requires entry-level position or volunteership. So, for instance, when I was in college, I actually worked as a assistant for an administrative assistant. So I was like I delivered mail, inter-office mail between the different offices for the chief executive officer of the University of Chicago hospitals back then. And so I just delivered mail from office to office. I filed. I did a whole lot of filing back in the day when we actually had paper files and file cabinets. And I just did tasks. I was a gopher, basically. And that helped me think about the inner workings between offices within a department across an entire hospital. And so that was my entry-level position into really starting to think about, healthcare. This is interesting. So that, I hope that answers your question. Please ask again if we're not getting at the right point that you want us to make. The next question is, I earned my bachelor's in science in health science 11 years ago and a master's in public health degree and PhD degree 3 years ago with the hopes of becoming an epidemiologist or health educator, but have been a stay-at-home mom of 3 children for the last 10 years. How do I fill in these gaps on my resume? Be honest. I love it when people come to me, they've come out of, they've had to deal with life. Life happens. and then they've come to a point in their life where they're ready to transition back into the workforce. It happens a lot. It even happens for my fellow physicians. It happens for lawyers, all people from all careers. And it's not just women transitioning out because of caring for young ones. A man or a woman could be caring for their any loved one, a partner, a spouse, a grandparent, an aunt, or just a dear friend. We all have times in our lives where we need to take time out and focus on something else and then come back into the career. So the honesty is the best policy, and that can be wrapped into a cover letter. It can be wrapped into an interview. That is how I would approach things.
I actually saw, I agree with you, Melissa. I actually saw that articulated really nicely by someone I mentored who actually went into pediatric dermatology at a well-known institution in the Midwest. I'll leave it that way.
Mm-hmm.
And she had taken time out and she was panicking because dermatology is a very, very competitive residency program. And so that's when someone finishes medical school and they go into extra training in what we call clinical training so that they can ultimately practice independently as a doctor. And she chose to do dermatology, and she said, how am I going to get into this program? How am I going to get into dermatology at all? And she actually wrote that in for that residency. She did a personal statement. But Melissa's mention of a cover letter is what you would do as you try to enter the job market. But just think about the residency as a job market, and she wrote it in a personal statement. And she talks about what she learned taking care of her baby and how important that was. So I think we have moved away in the 21st century from the fact that your resume cannot have any gaps to having a gap that you articulate about in your personal statement or in your cover letter, and then do it well. Just be honest and open and talk about. Mothers have a lot of skills.
Management and leadership.
Management and leadership.
Communication.
Yes.
All of those skills are prioritizing, multitasking. All the mothers who are watching this are going to be like, and fathers, actually. Fathers have to do that same thing. So, or caregivers, actually. It doesn't have to be of a young child. It can be of your grandparent or an elder, absolutely. So,
and I think you stand out. Don't you think your application will stand out? You make it, put it together really well, and it stands out.
One other trick is it would be helpful if over the next few months as you're starting to apply, actually start to read some of the literature. What's coming out in epidemiology, for example, that really excites you? What's new? You can find that through Google. That's why I love the internet. Back in the day when I was little, we didn't really have this access. It was like Encyclopedia Britannica.
Yes.
So I'm dating myself now.
It was Encyclopedia Britannica for me too.
But in all honesty, that actually will even put you ahead of the other applicants if you can relate what's happening now that's exciting you and driving you to really want to get back into the workforce. Like, for example, the recent Ebola outbreak. Maybe as an epidemiologist, you wanted to focus on infectious disease epidemiology and about study new and emerging diseases and how to control them or prevent them. That could be something that you could read a little bit more about, watch some videos online too about from CNN and TED Talks and things like that. And that can help you articulate better to the future employer why you want that particular position.
And a mother could talk about the fact that, I'm concerned about vaccinations and the spread of recent outbreak of measles or so on.
Right.
And I'm as a mother thinking to the future, I might be getting back into the field and being able to use my skills to actually help children and to articulate the position of the CDC in a way that will resonate with mothers and getting them to maybe start vaccinating their children. So you can start from that and take that leap, but your application can stand out and look rather interesting.
I think you absolutely can sell yourself really well.
Absolutely.
Right. Next question. I got my master's in science 4 years ago, but I haven't worked in the field. Now I'm considering preparing to apply for med school. How does one address these gaps so that they don't become an obstacle for admission? And I think we've covered this already. What's important is you're honest, you're open, and you can circle back to what you've done in the last 4 years, and you could have been an investment banker, for example. But you learned the certain skill set as an investment banker and a certain lens, and now you want to apply to medical school because you still are passionate about science, about caring for people, fill in the blank, and that you've learned these particular skill set as an investment banker that will help you actually apply those skills in a whole new way, and you could really contribute as a unique student in the student body of a particular institution because you've been an investment banker and taken some time out and have a different perspective on life and people and management and leadership, etc.
And giving an actual example of that, we have a resident in our program who graduated from MIT, Massachusetts Institute of Technology, and went into investment banking. Actually, a lot of MIT students do that. And he was there for about 2.5 years and then applied to medical school. He wanted to get certain skills. He wanted to also earn money for medical school and so on. And he was able to articulate that, come back to medical school. He went to Stanford and actually he's finishing up his residency here at Northwestern. So you have a lot of people who are doing that. That will not hold you back.
So it looks like we have 10 more questions and very small number of time. It's very small amount of time. So we're going to try to have more specific, focused answers and hopefully get through all the questions if not. If not, we can always post written answers to the board. And I'm sorry, these questions have been so wonderful. Thank you for all your participation. The next question is, I have a general curiosity question regarding the MD versus DO credential. How well received is the DO credential in academic and clinical settings? Furthermore, is there an advantage to the DO clinical approach over the MD as a path of study?
Well, what you see happening, Melissa, is that we have moved away from the DO and the MD, the DO being Doctor of Osteopathy or Osteopathic Medicine, and the MD, medical doctor, means that we're doctors of allopathic medicine. Basically, osteopathic medicine, medicine's premise is on the fact that diseases have a lot to do with spinal alignment, and if you can get the spine back in alignment, you can certainly make people better. That being said, we're seeing where people are going to either school and they're really not focusing on a particular philosophy, but they're just taking the courses for in medical school and becoming doctors. In terms of, is it a disadvantage? No. Number one, they're both 4 years. Number two, you can get residency in either place. Many DOs are doing residencies in allopathic medical programs. Number three, just to throw into the pot, we have several leaders in our institution who are doctors of osteopathic medicine. The overarching director of all the medicine residency programs here is a doctor of osteopathic medicine. One of our leading and vice chair and program director for infectious diseases here is a doctor of osteopathic medicine. One of my former fellows from 2 years ago is outstanding, who is a doctor of osteopathic medicine. And so over the years, we have seen them coming together more and more. In fact, when they send out things about the boards that people take, especially in geriatric medicine, it's coming from both osteopathic boards and the allopathic boards. And so they're talking and they're becoming more intertwined, and I wouldn't be surprised. It may be blasphemous what I'm saying, but I wouldn't be surprised if in 10 to 20 years we merge and become just one. So there really is no difference in that.
But there's philosophy.
There's philosophy difference.
If you look them up online, there are philosophical differences and philosophical differences in approaches to the care of a patient. Yes. So, but from a practice standpoint, there are different ways we use our medicine and we practice. But in terms of faculty positions, I have DOs in obstetrics and gynecology, and there are MDs in obstetrics and gynecology as well. So there's definitely a synergy there, but they are unique. So it should fit whichever way you go. It should fit your philosophy and how you feel about practicing medicine.
And I would recommend that you go to the site for the American College of Osteopathic Medicine.
Yes.
You can Google that to get more information on exactly what their philosophical approach is.
And if you still want more clarity, you could actually call them, just like I recommended in the last Google Hangout. Calling the professional society is actually really important because it's a good resource. They can sometimes connect you with a particular person in that field who can talk to you more about the differences. Okay, next question. I am in Rwanda doing healthcare management at Southern New Hampshire University. I wonder which ways can privatizing healthcare in developing countries can be a good way to empower the healthcare of these countries? Wow, that's a great question. I have to think about that.
Privatization in developing countries has been a long-standing thing. For instance, in Jamaica, you have, and they tend to work side by side with the public entities. I don't know if you're thinking about totally privatizing. I'm not so sure that's a great idea, because of the corruption certainly exists in the public sector, but there is a concern that it might really ostracize a portion of the population, and they might not have access at all. Sometimes a little access better than no access at all for people when they're sick. So it's always existed. There are private clinics in India, which is of course not a developing, but rather a developed country. But I mention that because it's so populous. But there are certainly in the Caribbean, you have a private doctor down the road, and many of whom actually work for the public hospital. So I think it's always been there. I'm not so sure it's a good way to empower the healthcare per se, because it will always be somewhat based on money and funds. And in developing countries, a lot of people just don't have that. So I really would, without having time to think a little bit more deeply on this, at this point, I would say I'm not so sure it's a way to go to empower the healthcare of those countries.
Yeah, I would defer. The next question, I have master's in biochemistry from India. Now I live in the United States. What are my options to get a job in healthcare? Under which category can I apply? There's lots of options. You have a master's in biochemistry. You could be in research. Yeah, that's the first one that comes to mind. You could teach. Local community colleges actually around the United States sometimes allow teachers or even lecturers to come in with a master's degree to teach. So there's a wide variety of options. What I would like you to do is hone in into a little more into what do you like? What do you like to do? Do you like to teach? Do you like to do research? Do you like to support a research team? Do you want to do more management and administration, in which case you may need a little more experience or another degree? So we need a little more detail to get you to a more specific answer.
Might I jump in?
Sure.
To get started, if you really want to get a job quickly, I think maybe applying for research administration positions where you're supporting a research team until you can figure out your pathway might be a good way to go.
Right, or a research assistant.
Research assistants,
Yeah.
That's what I meant, yeah.
Next question. There are many ways to serve the community. How are people able to choose I'm sorry, there's a pop-up in here. I can't see. I'm sorry. There are many ways to serve the community. How are people able to choose a profession or field that helps them be involved in the community? Well, it depends on what you're defining as community. If you mean the community where you're from, or the culture, or maybe a neighborhood area that you really are passionate about, or a place that you grew up and you want to go back and help serve, then there are plenty of ways to integrate a position or a job or career that helps give back directly to the community. You could work in a local organization that helps build programs that are related to health promotion and disease prevention and disease control in a particular community. If you're talking about a community of a certain community of professionals or teachers, then there's a way to contribute that way. I think I need a little more specific question in order to help hone in on an answer. And we can continue these questions on the discussion board. I'm happy to do that. And let's see, to help them be involved. And the other thing is volunteering for a particular
place in your community, like for a religious group or a youth ministry or youth health ministry. There's just a wide variety of ways to give back to your community that's focused on health or has a health lens. And another way, as I've shared over the path of this course, is that the research that I do is directly focused on giving back to the community. I partner with community organizations and community hospitals and clinics and really try to build programs that help improve the health of the community. I also work with legislators to try to shape policy that's related to health to help improve the health of community and the health of women, not only locally but nationally and internationally, globally. I help get people, students, through the pipeline of careers from a particular community to help get them into professions and on their pathway to a career. So those are just some examples. The next question. What job can you get with a bachelor degree in medicine? Do you have to specialize in something to become a doctor in accident and emergency? So in emergency medicine, I think
Yes,
that depends, right? Yeah, you want to go ahead?
So basically, I'm not so sure what you mean by a bachelor's degree in medicine, but here would not be, if anything, would be more a master's degree in medicine because it's a postgraduate degree in the United States. But if that's the way it is in your country and you're now fully fledged, fully credentialed doctor, then for emergency medicine, you have to do get specialty training. So you would need to do a residency in in emergency medicine. And I think that would be the same in just about any country. I'm familiar with the British countries, but I would want to think it's the same all across the world.
Unless you don't want to be a doctor, if there's nursing pathways, physician assistant pathways to be in emergency medicine as well, to be a member of the emergency medicine team, as a matter of fact, or paramedics. That's a whole nother discipline where you don't need to go into medical school to work as a paramedic. So I'm actually going to wrap this up. This has been amazing. I appreciate the level of engagement. I appreciate all these questions that you've asked us. I hope that you've got the answers, that at least some of the answers that will be helpful to you. I want to commit to answering these questions, and I'm sure Dr. McKoy will help weigh in on the questions. We will finish them in writing. We will have another Google Hangout, though. I guarantee there will be another one. There will be at least one or two more. So I want to keep this engagement because your questions are really important, because that's what helps make this course useful to you and better for everybody involved. So thank you, and thank you to Dr. McKoy for being here and spending your afternoon with us. Thank you. You took a lot of time out of your busy schedule, so I really appreciate that. I hope everybody has a good day. Take care and be well.
Take care.